Welcome back. We continue our discussion with Larry Anderson, CEO of Tri-City Medical Center, and welcome Jeremy Ramo, the Orthopedic Service Line Administrator at Tri-City. Jeremy, welcome to the Voice of Oceanside.
Thank you, John. It's a pleasure to be here.
That's great. Thanks for joining us. How about starting by explaining what orthopedic services means, what type of services you offer, and how it fits into the overall picture there at Tri-City Medical Center?
Absolutely. Orthopedics in this country alone, for the direct and indirect costs, accounts for about 7.7% of our gross domestic product. It's about $850 billion a year. So
I thought you were going to say of our medical expenses.
No.
Of the gross national product?
The gross domestic product, 7.7%.
Wow.
And at Tri-City Medical Center, orthopedic services, we focus on a comprehensive program from the head all the way down to the foot. So that includes spine surgery, it includes arthroscopic surgery. If you have a ligament or cartilage damage, that would be arthroscopically repaired. Also total joint replacement and minimally invasive procedures, which we'll talk a little bit about.
And about something like carpal tunnel, that fits into your category?
We have world-renowned specialists that do minimally invasive procedures for the shoulder, for the hands, carpal tunnel, and occupational health or work injury procedures are also performed within Tri-City Medical Center. So we cover the full spectrum from a work-related injury to just a degenerative change or an arthritic condition to preventing a surgery. That's one of the core areas of focus, particularly with the new wellness programs down at the Wellness Center at Carlsbad. We really try to minimize the need for an invasive procedure as much as possible.
Also with your service line, there's not just the pre-work, there's the post-work, because rehab is a significant part of this, I take it.
Absolutely. And rehabilitation, the surgeons do outstanding work when they're performing a procedure, but then the real work begins for someone recovering from that procedure, and their investment in exercises and the program set forth by both the surgeon and the physical therapist or occupational therapist is integral in maximizing the recovery from an orthopedic intervention.
The skill of the surgeon remains paramount, but technology has a huge impact on your specialty. So I'm understanding that things look a lot different today than they did 5 years ago. Can you give us a picture of that, a word picture?
Absolutely. Orthopedics in medicine is synonymous with technology. Almost daily, it seems that orthopedic technological advancements are being put forth in the marketplace. So you'll hear a lot about minimally invasive procedures. Minimally invasive procedures, according to the American Academy of Orthopedic Surgeons, they can, eliminate the need for a large incision. It keeps the incision smaller. It's more cosmetic. There's at times less anesthesia time someone would be under with a minimally invasive procedure. It can also lead to decreased hospitalization time because of less tissue damage, and also a faster recovery time. So minimally invasive procedures are paramount to what our surgeons are currently performing, and also on the latest, gaining the latest skills to be able to continue to offer more and more minimally invasive procedures in other areas of the body.
Just to really give a real good picture, can you give us an idea of, either in terms of size and inches or with your hands, the old-fashioned way, and just how small are we talking about now? I mean,
yeah.
What was it for a knee replacement or a hip replacement?
Sure.
And what is it now?
Sure. If you're looking at a traditional knee replacement, and I've seen patients, I'm a physical therapist by background, I've seen incisions about that long, and currently I'm seeing incisions about half that length. And one of the procedures, that's for a typical knee replacement, one of the procedures currently being performed at the medical center is called a Birmingham hip resurfacing. So historically, what you would see is this is a normal hip, and you have the shaft of the femur and the ball, the head of the femur. Historically, when you have a hip replacement, the whole part of the head of the femur would be removed and replaced by a metal post with the ball on top. Currently, instead of removing all of this healthy bone, just the arthritic edge is removed, and then we replace that with a cap. So you're maintaining all this healthy bone so that if by chance down the road you'd need another procedure, you have a lot more bone that's preserved. And that's one of the latest innovations that with the appropriate consultation with your physician would be appropriate to be performed for you.
And of course, a smaller overall impact, right? Because
Absolutely.
you're operating on a smaller area.
Absolutely.
Now, are there, is that indicative of what's going on with orthopedic work in other joints?
Absolutely. There are custom fit matched knee replacements where preoperatively there's specific tests being done to gain an exact measurement of a person's knee, such that, you know, your knee is different than my knee. We're not going to pull an off-the-shelf knee and put it in. We're actually going to get precise measurements so that the knee fits exactly what you'd need. And so this allows the surgeons a lot less time in the operating room, which is less blood loss, and it enhances the recovery on the post-operative end as well because of less tissue damage as well.
I'm going to ask a crazy question. Are we headed to a space where under normal physical exams we get this stuff recorded, so if there's traumatic damage we know what it used to be like?
That's a very good question, and certainly the technology is out there today to be able to record the specific measurements, and how this technology is used in the future may very well lead to many of these procedures being performed in an outpatient setting instead of coming into the hospital. We're not there yet, and I don't think we're going to be there for quite some time because of the risks of the blood levels, but we really are moving towards less and less invasive procedures, which means less pain and a quicker recovery.
Now, one of the things that I'm sure a lot of people picked up on is this preventative aspect.
Yeah.
Because no matter how great your services are, obviously we want to work on prevention rather than repair. Can you give us some tips on how to reduce joint pain and or prevent injuries?
Sure. That's an area that's vital to most of us, and that's how do I eliminate pain and injury and prevent a surgery. So first and foremost, pain is a good guide. If you're having joint pain or spine pain, what that's indicating is whatever position or activity you're performing that is creating the pain is signaling your body that something's wrong, and you want to listen to it. So through a dialogue with your physician and also a specialist if needed, then we can pinpoint preventative aspects to help avoid an intervention. So protecting that joint is paramount. If you're having knee pain, for instance, and you're kneeling or you're doing a lot of squatting, that's going to exacerbate the compressive forces on your knee and could lead to more pain. So joint protection is the first and foremost aspect to relieving the pain.
So working through pain is probably not wise.
You want to listen to it, listen to your pain, and there is the common term, no pain, no gain, but under a supervised setting and in the right mode, that can be true. In other settings, in a preventative setting, you certainly want to listen to it and not push through it, because we want to prevent the possibility of further tissue or bone or joint damage. The other aspect of prevention is lowering your body mass index, which is a fancy term for...
Is that losing weight?
Yes, you got it.
Hey, I've been to medical school.
That's right. So losing weight. And imagine carrying around a 20-pound barbell all day long in your hands. That 20-pound barbell is going to fatigue your hands, your forearms, and your arms by the end of the day. Now what happens to us is we're carrying around some extra weight that at the end of the day, we don't realize that it has had a detrimental impact on our energy levels and also on our bone and joint health. So weight loss and also a comprehensive program of diet and exercise with the right input from the medical professionals and some of the professional folks at the Wellness Center would really help optimize some preventative techniques.
Before people embark on combined weight loss and exercise, particularly heavy exercise, do you recommend that people come in for an evaluation?
Absolutely. And one of the, we want to prevent pain. And in rehab and even in personal training and fitness training, you can gain a lot of traction in pain prevention through exercise, through doing the right stretches, and also in an aquatic environment. If you can imagine having an arthritic joint and you go for a run on the street versus a run in the pool, the buoyancy of the water actually takes the stress off the joint. So you can increase your cardiovascular and get that weight loss benefit of exercise without the detrimental effects of the vertical loading on your joint. And at the Wellness Center, we have the only one of its kind in all of Southern California called the HydroWorks pool. And this is a pool where you walk out flat and then we drop the floor down up to 6 feet. And that allows the therapist or the fitness professional to reduce the stress on the spine, the hip or the knee or the foot, and really gain some advantages in the recovery process and the prevention process where historical land-based therapies and interventions may fall short.
And that's at the Wellness Center.
Yes.
In Carlsbad that we talked about. And there's a next step program there?
Absolutely. And the physical therapist will work and develop a home program with a client. And what happens a lot of times is after they're done with physical therapy, it's like, now what? And there's a sense of nervousness on the patient's part about, I no longer have that camaraderie with my therapist directing my care. At the Wellness Center, we have a post-operative and also a pre-operative orthopedic program, which is a very seamless approach to the post-operative aspect of care. So you have your structured therapy, and then the post-op program in orthopedics is run by a trained fitness professional, and it's specifically designed for orthopedics for that continuum of care.
You know, you've come so far in the last 5 years, but I've got to ask, what's next? I guess there's some more new stuff on the horizon.
I'm going to turn to Larry on that one.
Well, Jeremy's talked a lot about prevention and minimally invasive surgeries, but in our board retreat in September, we agreed with the board to focus on 6 key service lines. And it's not to say we're not going to do everything, because we're a full-service tertiary care hospital. But you're hearing 2 of these service lines today, cardiovascular and orthopedics. We're also focusing on neurosurgery, oncology, maternal child health, and behavioral health. But coming back to orthopedics, what's going to be very exciting is we're creating around all 6 of these areas, but first cardiovascular and orthopedics, institutes and centers of excellence. We recently recruited a physician, a surgeon, named John Regan. He started what was known as the Texas Back Institute in the 80s. And he's a premier world-renowned surgeon. He actually has performed spinal surgery on the royal family in Saudi Arabia. They can have just about anybody they want to do their surgeries. He started the Texas Back Institute. It was the first premier back institute in America. And most recently, he's been affiliated with Cedars-Sinai up in Los Angeles, and he started the spinal program there. He's coming to Tri-City, and he's going to be creating a spinal institute here, which will be the 2nd institute that we'll launch, and that will be up and running by August of this year. By April, in just a couple of months, we'll be launching our Cardiovascular Institute. And these are co-management models where the hospital works directly with the surgeons throughout those service line areas. And we agree on outcomes and processes. The Centers for Medicare and Medicaid and the Joint Commission on Accreditation of Healthcare Organizations focus on certain indicators that they want. And we're using these institutes to increase the quality of care that we deliver throughout all of these service lines in collaboration directly with the doctors who not only participate in the institutes but can actually participate in the profitability of those service lines as well. So all of this is coming to Tri-City. You should look forward to seeing the launch of a spinal institute headed by Dr. John Regan and other spinal surgeons that practice at Tri-City, like Dr. Neville Aline. This will all be coming in the summer, and then we'll roll out the other institutes as we go through the year and create centers of excellence around them.
Another busy segment, a lot of information came out. It's time for our second break. We'll be covering the cardiovascular services at Tri-City when we come back and how they're saving lives. Stay with us. So